Good evening, everyone. Thank you, Honourable Prime Minister, for allowing me back this evening. We're at this time in the global space, adjusting to still so much and learning so much about the pandemic. The Prime Minister just made an announcement as it relates to vaccinated travelers and the reduction of quarantine. And so we know that there will be a lot of questions put towards the Chief Medical Officer, Dr. Laws, and also the Federal COVID-19 Task Force as how we will proceed for this, especially for those visitors who will be vaccination in place for 7 days. However, we have to realize that still we are in a pandemic, and it doesn't mean that we get to proceed without taking caution. If we do not take every step to mitigate what is happening, we can end up like Anguilla, and there are many other countries within the Caribbean that are known tourism destinations that still have community spread. So for us in the tourism industry, for both the Ministry of Tourism and the St. Kitts Tourism Authority, we're really pleading with our tourism stakeholders to understand that the only way that for everyone to benefit from tourism and have the impact of the trickle-down effect that it does provide to even the mechanic who used to repair buses for taxi operators that no longer is doing that. We need to understand that vaccination is our only hope. We cannot return to some point in time what 2019 was, where we ended at 1 million cruise ship passengers and we had over 130,000 stayover visitors. For us to go back to those days of 2019, we have to look to an answer, and the answer that we have only available is vaccination that will allow tourists to come here, enjoy themselves, to reduce the risk of our nationals and our residents from exposing themselves to persons high risk and also themselves being at risk. As you all would have heard and the Prime Minister spoke to a while ago, our first cruise is with Seabourn Cruise Line, and it is scheduled to arrive here on July 17th. Please note, 2 weeks ago we spoke about the phased approach to the resumption of cruise, and it is a phased approach as we had with stayover when we reopened our borders October 31st. At this time, we will only have bubble vaccinated tours operating, and this is not to force anyone to take the vaccine. I'd like to reiterate that. It is not forcing anyone to take the vaccine. However, how can the destination sell tours when passengers are required to be vaccinated and crew are required to be vaccinated by cruise lines? How then can we market the destination to say that we're maintaining our record of being safe if we also do not have bubble vaccinated tours, meaning that our tour operators and our attraction operators are not vaccinated? We hoped that in June the cruises would have resumed, but so far the first cruise is designated for July 17 by Seabourn. For those of you who know, Seabourn is a very high-end cruise line, and it is not a huge ship, it's not a mega ship, but it is a substantial ship that will be coming to St. Kitts. And as we like to say in St. Kitts, one of the reasons for our success is that we basically marketed and worked hard for basically every cruise line to come to St. Kitts, and Seabourn is our first. As I said, the first phase is vaccinated bubble tours only. It's not a mandate, but it is to keep us safe. We also hope that those tour operators and attraction operators, because you will be vaccinated, within your home also you'll be vaccinated. You've heard both Dr. Laws and you've heard Dr. Wilkinson speak to families and protecting our little ones, our young ones. If you are not vaccinated, you run the risk of exposing at a higher level your family to COVID-19, and our little ones really need to be protected. We've also, in our discussions to ensure that we keep all communication clear, all cruise lines coming into the Federation are to have the discussions with the Minister of Tourism, Minister Lindsay Grant, or through the St. Kitts Tourism Authority. Also, under the guidance of the Chief Medical Officer, all crew and passengers, I will reiterate, over 18 years old must be vaccinated. For those persons who are under 18 children, they must have a negative RT-PCR test taken 72 hours prior to home port departure. And also this will be also applicable to all crew and passengers. The home port for Seabourn is Barbados, and they, at this point in time, they are ensuring that their crew will be vaccinated. As per the guidelines through our CMO and CARPA, the equivalent of CDC, the approved vaccines for persons coming by cruise at this point in time are AstraZeneca, Moderna, Pfizer, BioNTech, and Johnson & Johnson, because it was recently approved. Please understand that all travel approved tours and attractions, we know that within the industry we may have larger businesses, but they also do subcontract out their work to smaller taxi and tour operators over the years, because we have done so well with cruise. Those subcontractors will also have to be vaccinated. Also, travel approved tours and attractions will have to be inspected, and ensuring that to get the seal, your staff have gone through the training and that you meet the requirements of the Ministry of Health and also the St. Kitts Tourism Authority. Please also understand this is not just about the private sector. This also includes SCASPA staff, immigration, customs, anyone interacting with the ship, the cruise vessel while it is in port. It is most important that we understand we can't have an individual that is not vaccinated, as it is a concern as it relates to where we sit, and we really would like for Seabourn to be a success. We saw last August when Sea Dreams, the Fred Olsen cruise was not successful. Persons thought that it could just work with protocols and testing. We now know that that cannot work. Vaccination is the way out for us, and if we really would like to have a success story for cruise, because we do not live on our own like stay over, it's built on itineraries including other cruise destinations, we have to ensure that we're doing our part to ensure that persons here interacting with the vessels are vaccinated. We are also encouraging for employers, tour operators, those persons who own their own businesses, to please do random testing, and this will be guided by the CMO and the guidelines at the employer's or the owner's cost. This is for your vaccinated staff only. For taxi operators and attraction owners, we also say that please consider at this point in time what the testing requirements are going to be, what the quarantine requirements could be, what isolation for your staff. These are now costs that must be taken into consideration as we're moving to reopen cruise, and also with now the acknowledgement of, the reduction of the quarantine from 14 to 9 days. This is very, very important, because for the next couple of years we're living with COVID, and we have to understand that this is going to be a cost that speaks to the operations of whatever your tourism entity is. It cannot be excluded. So we're really asking taxi and tour operators, as we transition through this period of continuing the phased approach, because we are open but with new requirements and with cruise, to take into consideration what is happening. We have agreed to work with the Ministry of Health and other government entities to see if we can also get a discounted rate for GNF for the COVID-19 testing, and then also speak to our private sector for those locations that have quarantine. What can we do for the tourism sector? We're in a difficult situation for those persons who we understand. There could be medical reasons, there could be personal reasons. They do not want to take the vaccine. We have to understand, and we'll take that in stride. However, we are also saying that requirement is, as per the guidance of the CMO, there will be regular RT-PCR testing, and that will be at the employee's cost to work. Now, this does not mean that persons who are not vaccinated will be allowed to work in the vaccinated bubble tours. No. Only bubble vaccinated tours will be allowed to operate at this point in time, because it is the safest way, especially for crews, for us to ensure that we have a very successful phased process of reopening cruise. We have had discussions with the neighboring destinations that are sharing the itinerary through the Ministry of Tourism, and the Ministry of Tourism for the other destinations. And it is important that we've recognized that each destination is going to have their own protocols. And for this to really work, for this to be a success, we all have to have basic minimum protocols to operate. And we had a call today, and we have basically agreed on some of the following. For those who are going to be home porting out of Barbados, specifically for the seaborne cruise, all passengers are required to submit a negative RT-PCR test 72 hours prior to the arrival at their home port. The 4 vaccinations from PAHO and WHO that are certified that I mentioned earlier, AstraZeneca, Johnson & Johnson, Moderna, and Pfizer-BioNTech. There's also the consideration that even though they have submitted their tests and they've been approved to go on the vessel, rapid tests are going to be required before, as a last-minute check for them before they board the physical vessel for home ports in the OECS and Barbados. There are some destinations that are not on this because they're not a part of OECS and Barbados, so therefore we could not include them, because only the OECS and Barbados at this point in time, as it speaks to St. Kitts specifically, and we know the itineraries that we are on, specifically for Seabourn for July 17th, we're speaking about. We all agreed it's very important to have a corridor of containment from gangway to gangway, and St. Kitts in this conversation was the only destination that basically had vaccinated bubble tours or attractions, and we suggested that this was the best way to ensure that we had a success. And so this is for common thought as it speaks to other destinations, and there were other destinations including the home port Barbados that agreed to this. I can't say if there were others that didn't, but basically we have all agreed that for this itinerary to be successful, we all have to have the minimum standards. Also, it was discussed that guests will not be permitted to integrate with the public, so someone cannot come off in Port Zante and walk through the arrivals hall and come into Bastille. Similarly, in other destinations, we felt that at minimum, even if there was this concern about bubble vaccinated tours because of the availability of vaccines in the respective destinations, we must ensure that we minimize risk and not mix with guests in the general public. And this, we understand, for those in the OECS and Barbados, was not something that they had an issue with. It's also important, and this came up, there are persons who may want to come off the gangway and they're just not listening. We do have sometimes passengers who do not listen. If they participate in an unapproved tour, it was agreed that they will have to disembark the vessel and pay for their return flight back to their home port. It would not be at the cost of their agent nor the destination. And this was to encourage cruise passengers to adhere to bubble vaccinated tours. I welcome, and I'm sure many persons in the tourism sector, the 9-day quarantine process, mandatory process. And at this time, we have been promoting the destination in the marketplace from April 1st. There has been a lot of interest in St. Kitts and Nevis, respectively. However, there were just concerns about the quarantine and what it entailed. However, at this point in time, I'm glad that we did take the initiative to start the promotion on April 1st. It will run until September 5th, the Labor Day weekend. So we have a huge travel window, and persons now, I believe, with the reduced quarantine period, and hopefully those persons staying 1 to 7 days, we will see what the CMO comes back and advises what is permissible in terms of tours or anything at all possible. But the opportunity, is really one for us, because the destination is automatically offering an automatic room upgrade. And also children, also for those properties who do offer for kids to stay, they will be staying free. So at this point in time, the destination is really promoting for the next 4 months, from April 1st to July 31st, for the opportunity for persons who would like to take a vacation specifically in our target market to come to St. Kitts and Nevis. Fortunately, I think it's well timed. A lot of persons also in the U.S. are looking for places to go post Memorial Day. It's been summer. Many families have not taken a vacation. St. Kitts and Nevis, we've been doing a lot of PR in the marketplace. And so we believe not that we are going to get huge numbers, but we will see incremental visitation for summer. And hopefully we'll maintain the positive rollout of vaccination in the United States. And hopefully we can have a very, very blessed Q4 with increased air arrivals. Thank you.
And thank you so much.